Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and today I'm joined by Dr. Monica Christmas. Can you tell our women who are watching who you are?
I'm an assistant professor at the University of Chicago. I am the director of the menopause program there and for the Center for Women's Integrated Health.
So, women understand menopause, no periods, menopause, there we are. But in that 4, 5, 6, or sometimes even longer leading up to menopause, there's that term we use of perimenopause that seems to lack a time frame or even a definition or a what do I expect as a woman. So not a tall order, but can you answer that?
So that perimenopause period is like you said, can be anywhere from a few years, a couple years, up to maybe even 7 or 10 years for some women, where you're starting to experience symptoms related to hormonal fluctuations. You know, our ovaries are getting to a point, they're tired, they're done. You know, at some point they're going to stop making the hormones that our bodies like, and there's some physical symptoms that we experience related to those hormonal changes, and that's what's happening in that perimenopause transition.
So walk us through some of the most common and distressing symptoms, because often women are confused. Is this some type of disease that's going on? Is this normal? Is this aging? What is happening to me? So some of the most common and when women should be seeking medical advice.
Yeah. One of the first signs, I should say, or symptoms is changes to the menstrual cycle. Some women are very fortunate. Their periods just get shorter. They maybe get lighter and maybe start to space out before they completely stop. Other women may have heavier, longer periods that are coming closer together before they stop. And then there's everything in between. So I would say that's probably one of the first symptoms to look for. Vasomotor symptoms, the hot flashes and the night sweats, and they can be very variable. You know, you'll have patients will tell me, they were really bad last month, doc, and I made this appointment to see you, and now I feel okay. But then the following month, they might be back again.
And the confusion for many women that you can have hot flashes and night sweats and still have some sort of cycle.
Yes.
So
Yeah.
why is that?
Well, because your ovaries at that point are still making estrogen and progesterone, and so you're still, the estrogen is causing the lining of the uterus to thicken. Your body recognizes that you're not pregnant, it doesn't need it, and you shed it. It's just not happening all the time in that synchronized fashion, right, where you're getting a monthly cycle.
So if you're at the point where you're concerned, and one of the first things women want to know, is this normal, meaning this is what I should expect? Or is there something else that might be going on that maybe this is abnormal?
Yeah, I think that it's always prudent to come in, right? Mm-hmm. And to have an evaluation, especially if you're in that camp where it's heavier, longer bleeding, because we want to make sure that there's not, it still could be related to perimenopause, right, but there could be other things that are going on as well that we want to evaluate for. Is there an endometrial polyp? Are there fibroids? Is it hypothyroidism that can affect menstrual cycles too? So we always want to make sure that we're ruling out all those other things. Some other symptoms that women may experience are mood swings, increase in anxiety and depression. Up to 40% of women in the perimenopausal time frame will have symptoms of depression or mood lability.
So I think it's so important for women who are listening to recognize that you don't need to put up with this and be silent if this is distressing.
Absolutely not.
So for women who really are all over the map with their menstrual cycles, and this is distressing, the unpredictability, it's impacting the quality of their life, what are the options for them?
Really it's based on what their most bothersome symptoms are. If it's the menstrual symptoms and they're like, I can deal with the other stuff, then we can use hormonal birth control options to help manage their bleeding. There are other minor surgical or minimally invasive surgical procedures that we can use too if somebody doesn't want to be on anything hormonal. So I think the bottom line though is that there are options. You don't have to just deal with it and be miserable.
So I think one of the most important messages you're giving to our women is the predictability of the unpredictability, that's the only thing that we can count on, and every woman's journey may be somewhat different and can be 6, 7, or 8 years, and if you're experiencing these symptoms, as you say, it's really prudent and advisable to come and see a healthcare practitioner.
And many of the symptoms, I think sometimes women feel like, well, I feel silly bringing it up. It could be that, their weight is changing, right? Weight gain is associated with just aging, but certainly associated with the hormonal fluctuations in perimenopause and menopause. And so oftentimes we think, well, maybe that's not important enough to talk to my healthcare provider about. But absolutely it is, because we can talk about, what are the lifestyle modifications that you can start to employ now so that you actually do maintain a healthy weight and don't have any of the medical comorbidities that can happen with, increasing weight too.
So I think the message that we're going to land on and leave on is that it's not about surviving the perimenopause, it's about thriving through the perimenopause.
Absolutely.
Thank you so
Love
much
that.
for joining us. Thank you.
You.